Hi everybody, I'm Rachel Bodie and I am here responding to one of my peers' posts for a anemia case study. So the scenario I chose was Afio's scenario. I am so sorry if I pronounced that wrong. So she was talking about Mrs. Lauren Jones, who's a 42-year-old female presenting to the clinic with weakness, fatigue, numbness and tingling of her extremities, a poor appetite, abdominal pain, and weight loss. She is the mother of 5 children, and over the past years, in between her pregnancies, she's had these recurrent infections of unknown origin and has just felt depressed. On assessment, her tongue is beefy red and sore, and her skin has a lemon yellow color to it. Her past medical history is positive for Crohn's disease, and her surgical history consists of 3 C-sections as well as a colon resection. With Mrs. Jones' presentation, she first had me looking into anemia of chronic diseases. But after further review of her symptoms, I suspect pernicious anemia due to the assessment of her sore, beefy tongue and her lemon yellow skin. This type of anemia results from an inadequate uptake of vitamin B12 due to a lack of intrinsic factor, which is made in the lining of the stomach. Vitamin B12 is obtained in the human diet from consuming animal products such as meat or dairy. The body can store vitamin B12 for many years, so symptoms typically don't occur for many years, upwards of 20 to 30 years before symptoms are persistent enough to seek medical attention. And at this point, it's usually in a very severe stage of anemia. It's the most commonly diagnosed in women over 30, and in rare cases, this type of anemia can be passed down from generation to generation. This anemia is very common in those of the Scandinavian descent or the Northern European descent. Potential causes for this vitamin B12 deficiency will be that lack of intrinsic factor, and that can be caused for many reasons. Including the surgical removal of portion of the stomach, so you have less stomach to make the intrinsic factor, or part of the intestines for absorption. So you had a bowel resection. I'm unsure if that was large intestine or small intestines, but nonetheless you have less bowel to absorb those nutrients than you originally did. And GI diseases such as Crohn's disease also make it difficult for your body to utilize that intrinsic factor in B12 and just vitamin and mineral absorption in the intestines generally. The presentation of this type of anemia includes a variety of broad symptoms, including nonspecific infections, which you've been having for many years now, mood swings, which I understand you're feeling a little depressed, GI problems. So with your Crohn's disease, the GI problems can kind of be hidden or bundled into that abdominal pain, discomfort, and living with Crohn's, living with that bladder or the bowel resection. Weakness, fatigue, those are common signs of any type of anemia due to the low oxygen levels in your blood, the hemoglobin carrying capacity. Numbness and tingling, that is a neurological problem that a lack of vitamin B12 can have on you. Weight loss, which again can kind of go back and forth. Is that wrapped in with your Crohn's disease and bowel resection, or is this a new thing that we need to try to discover? But your red beefy tongue and your lemon yellow skin are the 2 main factors that make me believe you have this type of anemia. The lack of B12 in the nervous system can cause a person to feel numb or tingly. It can cause clumsiness and impaired memory. Due to that decreased oxygen carrying capability, you will feel short of breath, tired, and have pale skin. In order to properly diagnose you, I would like to complete a CBC with peripheral smear, a blood vitamin B12 measurement, test you for the autoantibodies for the intrinsic factor in your stomach lining. So that's going to see if you are creating enough intrinsic factor to absorb that B12. So an intrinsic factor issue or a B12 issue. Test your blood levels of iron and the iron binding capability of your blood cells. I would also like to test for a sensitivity indicator for vitamin B12 deficiency. In addition to that, I would like to complete the Schilling's test, which is a measurement of how well your body absorbs vitamin B12. These are all blood tests, so they'll all be done with a simple poke, and we'll utilize those results to create a definite diagnosis. If my assumptions are correct, your anemia can be corrected with vitamin B12 shots. So initial injections of vitamin B12 are going to be administered weekly until the deficiency has been corrected, and then it'll be monthly every 30 days after that for the remainder of your life. The effectiveness of these IM injections has been highly utilized throughout the community and in science, and it's determining the effectiveness of vitamin B12 replacement therapy is determined by a rising reticulocyte count. So we'll be able to monitor that and make sure that these injections are being effective in treating your anemia. In this type of anemia, you're going to have a low hemoglobin, a low hematocrit, a low reticulocyte count. A mean corpuscular volume is going to be high. Your plasma iron will be high. The iron binding capabilities is going to be normal. The ferritin is going to be high. The serum B12 is going to be low. The folate is going to be low to normal. Bilirubin will be high, and transferritin will be high. So that's giving, the bilirubin's giving your skin that yellowish color. And I suspect that your anemia is going to be a combination of a malabsorption due to your surgical history and the lack of intrinsic factor due to your autoimmune disease that you're suffering with Crohn's disease. So we will go ahead and draw those labs today, and we will have them back and get you a definite diagnosis. But until then, I would love for you to continue following up with me. We will go ahead and give you your first B12 injection today and make an appointment for next week for you to come back and get another injection. And then we'll just kind of keep monitoring your blood levels to see when we reach that therapeutic level, and then we'll start those monthly injections. Mrs. Jones, do you have any questions for me at all? All right, well, thank you very much, and it was a pleasure meeting you.